conversation is with Dr. Paresh Kale, and we'll get into that shortly. A couple of quick housekeeping things as always. Please stay on mute and type away your questions in the chat window so that I make sure to get to all of those that were asked by the end of the conversation. For those who are not already members of the Longevity Lab, I think it's a great idea to become a part of it, and it's pretty easy to do so. Just scan the QR code or type in tryph.ai/join into your browser, and you should be able to get in. There are a couple of new community features that are coming up for those who are members of the community. The two are we are soon going to be announcing some discounts we are getting at verified imaging labs. So we talk about things like calcium CT scans, stress tests, 2D echoes, and all of that. And what we have done is we have checked out a number of different facilities. We're starting with Pune first. We'll expand to the rest of India and then outside India as well. But with these facilities, we have gone and negotiated anywhere between 25% and 50% discounts on these reasonably expensive tests. And as always, we will take absolutely no commissions or cuts. Whatever price they can give us as a discount gets passed straight on to you. We'll be announcing specific locations and rates shortly, so stay tuned for that. The second thing I wanted to quickly talk about is there is a lot of spam and scam happening on WhatsApp in general. This is a public announcement. Enable what is called two-factor authentication on your WhatsApp. To do that, go into settings in WhatsApp. Within that, you can go to accounts, two-step verification, and you put a PIN. We'll try and also put this in the notes so that for those who want to go through all of this, it'll be easy, but absolutely worthwhile to do so. And Nirita, can you put somebody on mute? That somebody is not on mute and there's a lot of background noise. Yeah, I think I know who it is. All right. Moving on. Our next week's speaker is Dr. Taylor Sittler. Taylor is the founder of one of the largest genetics and genomics company in the United States. And since then, he's been the chief medical officer of Levels Health, which is the pioneer in the CGM space. It'll be quite an interesting conversation with him for next week. All right. With that, let's move to the man of the hour, Dr. Paresh Kale. As always, it's impossible to do justice to the speaker's background, and so there's a very shortened version I put over here. But and I'm happy for you to read through it. But I want to provide you my interactions and my feedback on Paresh. Paresh has actually been a supporter of our parent company GenePath for many years. But Paresh is a renowned prosthodontist and implantologist, which is actually another way of saying that after he finished studying dentistry, he enjoyed studying so much, he kept going at it, and he has never stopped studying. And so he took over at his dad's dental practice in Pune, and he's grown it significantly since then. From what I understand, some of his patients have been his patients in that family across 3 generations. So that's a very impressive thing. And I understand that his patients will never let him retire because he is just considered very accessible. His focus on patients and his patience with patients is legendary. Paresh is an early adopter of technology, and I can tell you that firsthand because I remember about 3-4 years back when we released the CGM, the continuous glucose monitoring program. I think, Paresh, you are one of the first to sign up for that. And from what I heard from a common mutual friend who I know. I'm sure you know who I'm talking about. Uh, that you love farming and you grew up on a farm, and I think your interests are varied from farming to golf to keeping up with technology. And so, without further ado, Paresh, welcome to the Longevity Lab community video meet.
Thank you, Nikhil. This is quite an interesting introduction. Thank you so much. I'm so glad to be here.
No, likewise, we are very, very excited. So, Paresh, let's start with just a very basic question about, we talk about oral health, and this whole conversation is about oral health. What is the definition of oral health?
Well, there's no one definition to oral health, but oral health would comprise of healthy teeth, healthy gums, teeth which are properly aligned. They're not impacted. They are kind of straight so that they are easy to clean. The skin of the mouth, which is called as oral mucosa, is healthy. It's typically pink, sometimes with some colors, freckles. The tongue is a very important constituent of the oral cavity. Its health that does not have a lot of coat, it has the right color is very important. One of the most important things of the mouth for its health is adequate saliva. Uh, so having adequate saliva that flows over teeth or that we continue to swallow without knowing is extremely important. Uh, just outside the oral cavity, we have joints which help move the jaws. They're called temporomandibular joints. And the muscles that attach to these joints, them being healthy, is extremely important as well for oral health and function, which is grinding and speech. When they are not, or even besides, one could be exhibiting parafunction like grinding, which is not always very healthy. So, no parafunction is an important constituent of good oral health. Uh, Not having any developmental anomalies, like maybe cleft palate or having some teeth missing, is important. Is an important part of the right oral health. The respiratory passage begins with mouth and nose, of course. So they have a correlation with one another. So, uh, mouth being in sync with the respiratory passage is important also. And lastly, if not the most important for most of us, is having a good smile from that oral cavity is very vital. It makes a large part of our personality, confidence, you know, social interactions, etc. So
Yeah.
that's how I can summarize good oral health.
That's as you were saying all of this, I was thinking to myself, I'm like a walking, talking lab for any dentist. Almost all the things you have spoken about has been done in my mouth. Of course, the usual cavities, implants, uh, my jaws were misaligned. I mean, just all the things I wish I'd heard or spoken to you many, many years sooner. uh, grinding, I never appreciated what it does to the teeth and to the whole structure uh, of the mouth and the face. So that definition I think is very helpful because I would bet money that almost everybody has one of those issues off, whether we know it or not. Right? So given that as a background, uh, Paresh, what are the how do issues show up in the mouth? How does one know that they have an issue? Cavity is relatively easy because it hurts, but some of the other things may not be that easy to know. How would we know?
Well, I speak as a clinician. Most of the times, patients end up seeing one of the most common reasons why they end up seeing a dentist is that they have pain, and the pain can come from a variety of places. Most common places are having cavities. Those cavities may have grown, infected the nerves of teeth that causes infection. The gums could be an issue. With gum disease, one can have bleeding gums, pus coming from gums, foul smell, bad breath, etc. When the gums disease advance, you get teeth which become mobile. and that can be a reason why mouth may not be healthy. Uh, One may have sensitivity of teeth, and there are a lot of reasons why one can get sensitivity. Cavities, having spaces in between teeth, can cause food impaction. That's another issue in the mouth where patients end up seeing a dentist. Discoloration of teeth, deposits collected on teeth indicate some things. So these are kind of typical signs from teeth for which patients uh, suffer from something or the other. The other things that not healthy mouth may show is some white lesions uh, on the gums, on the cheeks, on the tongue, which are indicative of something. Patients with, say, anemia, deficiencies of vitamins, iron, uh, diabetes for to some for some cases. Um some advanced medical conditions like renal failure, some may have some signs that show in the mouth as well. Uh, Sinusitis can be one big reason why one may end up seeing a dentist where the problem is in the sinus but teeth are hurting. So since mouth is so close to so many other organs, uh, those symptoms can exhibit in the mouth. If one is a grinder, one may show with sore muscles, joints that make noise, uh, joints. There's difficulty opening, closing, etc., etc. Can be one reason why one may suffer in the mouth. Some bone conditions may show in the mouth. Some bone diseases. In very rare and very extreme cases, some tumors, some cancers may metastasize in the jaws and can be one place where dentists find something the first. Uh, what else can I say?
In fact,
Some
Paresh, if I
things.
remember correctly, you had
Sure.
also said there were cases where leukemia was
Yes.
detected early to the point you were just making by the
Yes.
dentist who figured it out in the mouth before anybody else knew.
Absolutely, because some leukemias may not have symptoms otherwise, and there may be some changes in the gums that may raise some suspicion. And a discerning dentist who's keen may find some of these signs first in the mouth, and that happens.
Yeah.
Uh, the other thing that can be commonly observed is dryness of the mouth, and the issues for dryness can be local or they can be systemic. Some drugs, some systemic conditions, radiation, chemotherapy can cause dryness, and the effects of that are pretty serious at times.
I mean, given what you just said, Paresh, it's given me some newfound appreciation for why one should go to the dentist, not just for teeth and gums, but it may actually be an early warning indicator for many other issues that have nothing to do with the mouth, but that show up in the mouth, right?
Absolutely,
And
without a
with
doubt.
the advent of I don't think it's going to take a long time before images of the mouth, the correct images of the mouth, along with the expertise of the doctors, could flag things pretty early.
Yes, certainly. I mean, there have been times when you know cases like leukemia are found by a dentist. Sinus infections we've diagnosed before anybody else. Bone conditions, which are maybe systemic, are diagnosed in the mouth, etc. I mean, yes, examination of the mouth by a professional on a regular basis is extremely critical, and it can reveal some things which may take time to notice otherwise.
Yeah, yeah, no, it's fascinating. And, um, I know there were some studies done recently where people looked at the eyes and figured out things like Alzheimer's. I mean, nobody thinks of eye examination to have anything to do with Alzheimer's, but it's the exact same thing here. Nobody thinks about mouth examination having anything to do with leukemia or, sinusitis.
Yep, absolutely.
Um, and so then let's take it one step further. I mean, there are some of the things that show up, but poor oral health has been known for a while to also be the cause of things like heart disease. Can you talk a little bit more about how that is all connected?
Yes, you know, there are two kinds of infections. Ones are called acute infections like appendicitis, flu, etc. And the other kinds are called as chronic infections. Acute conditions typically have an early onset, they are debilitating, they need immediate attention, and they almost always recover almost completely. Whereas chronic conditions have a very slow onset, they may not get noticed in time, and they may remain unnoticed for a very, very long period of time. One may not even know that one has a condition unless it is examined or diagnosed by the right methods or tools. Now, the, 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 the problem is that these chronic conditions don't just keep to themselves, but have effects on general health, because chronic conditions, the body is trying to defend. And in doing so, it is producing certain elements, it is doing things to be able to keep those infections under control. And so we would call that as a low-grade immune response to these chronic infections. And
Or is that
they
effectively inflammation, Paresh? Is that how it shows up?
absolutely.
Hmm.
Absolutely. I mean, infection has a contribution, has an element of inflammation to them. And you know what chronic inflammations do? Inflammations, even being excessively obese is a reason for having inflammation in the body. So these chronic inflammations do produce effects which have implications on general health, like cardiovascular disease, or like causation, or being a predisposing factor for Alzheimer's, maybe arthritis, maybe immune dysfunction, autoimmune disorders, etc., etc., etc. Because there are mediators which are released by the chronic infections, which are mediators in these conditions.
Yeah.
So, and the mouth, from the mouth, chronic conditions like gum disease, periodontal disease, what is commonly known as pyorrhea, and cavities causing infections of the nerves and the areas around the root tips, which are called as periapical infections, dental infections, having third molars which are infected. These can be a very common source of infection. You know, by some count, 40 to 50% of people have some kind of a gum disease, and probably a similar number of patients may have some cavities. Impacted teeth which have not erupted yet and get inflamed, infected, is a pretty common situation as well. It's not just in early years of life, but at any time in life when those teeth tend to show up.
Yeah. I can't tell you the number of friends I've had over the years who uh, refused to go to the dentist. And their answer in the beginning was, I don't think there's an issue. And then over time, the answer changed to, it'll be so embarrassing for me to now go to a dentist. I don't want to show my teeth. But
Yes,
given this role that sort of chronic low grade inflammation plays on everything else, I think the thought process has to change to, I don't want my overall health to be impacted. Forget doing it for your teeth, do it for your overall health.
absolutely. And this is something, it's not something new, but the awareness about that has become more acute in the recent past, about effects of chronic inflammation, infection on general health. And it's very good, because then, more people will go to a dentist and seek help or treatment in time, because they're concerned about general health. By the way, they're concerned about the dental health as well.
Right. Absolutely. I know this is relatively early research, Parish, but people talk about the gut brain, the microbiome connection, right? But there's also gut, mouth brain connection. What is your take on it? Is it early? Is there enough over there?
I don't think there's enough on mouth brain or mouth gut connection. But the oral microbiome of the mouth is extremely peculiar, and it's extremely diverse. You should be able to see at least 800 types of different bugs in the mouth, varying from starting from bacteria to all the way to viruses and etc. So, and these are residents of the mouth. Their balance, their their diversity and balance is quite typical, unless it is disturbed by certain things, and those certain things could be misuse of mouthwashes. Too much of antibacterial mouthwash use is not good, or certain medical conditions, or having dryness of the mouth, having too many cavities, having gum disease would alter the oral microbiome in a direction which is not healthy. But I'm not quite aware of that altered microbiome, besides the effects of chronic infection, inflammation, that these increased bacteria, which are pathological, that may have effect on the body via the mediators. But having those bugs alone causing some access with brain or gut, not yet. No.
Yeah. And just for the audience, I just want to sort of clarify one thing. Uh, Paresh referred to the 800 or so different types of bacteria and so on, the microbiome in our mouth, and they actually play a role. They play an important role. And so Paresh referred to the balance. It's not like, oh my God, I have bacteria, I should get rid of them. No, they play an important role and they need to be there. The issue is you take antibiotics, you have infections, those 800, that composition changes. And when that composition changes, that's when trouble happens. And so, I just wanted to clarify that. And Paresh, anything you want to add to that?
Yes, that they are there in diversity is important to keep each other in check. So they play a role with the oral health, as well as not allowing some of those which are common cells of the mouth, which may cause infection when the number flips. So, for example, Candida, which is a fungus, and that's found in several places besides the mouth. You could have candidal infection in the mouth when this microbiome is disturbed. When the other gram positives and negative bacteria are because they help keep the balance between each other. So it's like a check on one another situation by these bugs on one another.
Yeah. And I think you also made an important point, Paresh, about uh, historically people were told brush your teeth, floss your teeth, but then over time it also became, hey, start taking these mouthwashes. And now we're finding out that mouthwashes aren't always great. uh, and 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 so what's how should one think about these types of decisions?
Okay. So we need to define what is the objective behind these activities, right? The objective of of doing these, shall we say, activities, or hygiene maintenance protocols, is to maintain plaque. Plaque is a sticky substance that collects around teeth, irrespective of what you do or what you don't do, which consists of proteins in the mouth, which secreted by saliva, which precipitate and collect on teeth and gums, even on tongue. So this film of protein uh, collects dead skin, bacteria, food particles, etc., etc. It's called pellicle, technically. And when this collected plaque uh, matures, when those bacteria have time to colonize and multiply, is the time when they would start showing their effects. So it takes a few days, if not weeks, for these bacterial colonies to start showing their bad effects, because of the toxins they produce or because of the acids they produce. When they produce toxins and are at the gums would start getting inflamed, the gums would break down, the bacteria would invade the crevices of the gums, and then what you get is called perio disease, gum disease. When it's extensive, in common terms, it is called as pyorrhea. There is bleeding of the gums, pus formation, teeth become mobile over a period of time, etc. When these bacteria are of the type where they produce acids from breaking down carbohydrates, these acids dissolve the surface of the tooth, and that dissolved surface of the tooth makes the surface rough. So the plaque attaches better and more easily, and then it becomes a self propagating issue whereby cavitation forms. So the objective behind any exercise to maintain health is to remove this plaque. Once you can make this tooth, make this mouth or make these teeth free of plaque once in at least 24 hours, you are going to help keep the mouth healthy. Uh, and there are a variety of ways by which plaque can be maintained. A good simple brush for a healthy mouth should be good enough. Having the right kind of brush, which means a soft bristled brush, not very complicated. When done by the right strokes, not like you would brush your wash basin or your floor, but in the right with the right kind of vertical strokes, is enough to remove the plaque from teeth as well as from the gum margins or from the gum level. Floss helps to get in between teeth, where at and under the contact, uh, your brush may not reach. So if somebody has tendency or has potential for higher potential for getting cavities or gum disease, uh, one may resort to using a floss. The other tools like toothpicks and interdental brushes or water pick are kind of tools, gadgets which may have place if there is a need for them. Not everybody needs to use a water pick. Not everybody needs to use or can use an interdental brush. So it's kind of need based if there is a need. When there are spaces in teeth, one needs to get in between them, and your normal brush may not be able to do a good job. So that's about the physical methods of doing plaque maintenance.
Uh,
On chemical
Paresh,
side,
on
yeah,
the physical thing, one quick last one. How about
yes.
a tongue scraper?
Oh, that's a big one. Big one because uh, some people believe in that as if there's no tomorrow without them. But I don't like the, shall we say, effects or side effects of somebody cleaning tongue. Well, some people like to feel their tongue being scrubbed. But I don't see anything in the science or in practice where if you've not cleaned your tongue, you're going to be unhealthy or you're going to have issues. So it's more of a feel thing than need thing.
Right.
Some people like the effects, the severe effects of cleaning tongue. I I don't know. I mean, I have never done that. I don't see anything in our science to that recommends or shall we say mandates. But if one feels good about doing it, why not? I mean, it doesn't do any harm for sure if it is done adequately and properly.
Correct. And then you are moving on to the chemical side of things.
Yes. So on the chemical side, uh, you know, there are a few things. At the right age, with the right kind of fluoride used, I know there's a big talk about fluorides being deadly and they should be banned and all that. But there's adequate research that shows that fluorides are absolutely wonderful on teeth when used properly in population and in areas where there's no excess fluoride. The issue is where there is too much fluoride in the water that you're getting. If that is, and that's in small pockets almost all over the world. It's not everywhere. Most of the water that we get does not have very high fluoride. So when water is not adequately fluoridated, or even if it is fluoridated, using a fluoride mouthwash at the early years in your life does build up fluoride layer onto your enamel, and that definitely 100% is proven to fight tooth decay to a certain extent. It does not stop tooth decay, but it definitely makes teeth more resistant to tooth decay. The kinds of fluorides can vary depending on the age, the severity of, shall we say, karyogenic potential, etc. But yes, fluorides are useful. They need not be used all life for everybody, but for those indicated, they're definitely very useful. Uh, the second type of mouthwashes would contain anti-plaque agents, like chlorhexidine. They are not meant to be used for long term. They're meant to be used as medication, for the mouth. So if somebody has undergone a mouth surgery in the mouth, if maintenance of hygiene is difficult, then those are recommended. When used long term, chlorhexidine or betadine could have some side effects like supra infections like candidiasis, etc. So these are not meant to be used for long term. And then the third kind of mouthwashes I would call as makeup. You know, all those make you feel good. And a lot of people find them indispensable. Of course, if you like them, go ahead and use them. But if you ask me, do they have 12-hour effect by the antimicrobial action that they have? I would say, hell no. It is not required to have the antimicrobial effect. If it makes you feel good because of the mint or whatever flavor in it, please go ahead and use them. But don't do that because it's going to be healthier or useful for you.
Is there any downside to these mouthwashes, Paresh, at all?
Well, well, the common FMCG made available mouthwashes don't really have significant downside. I mean, I don't want to take any brand names, but the ones that are popularized in ads and are are used as make you feel good kind of things don't really have significant downsides.
So they don't have too
But the
much of a
medicated
downside.
ones,
They don't have too much of a
the,
downside or an upside.
well, there is no use. If it makes you feel good, by all means.
Got
But
it.
the medicated ones, betadine, chlorhexidine, gluconate, should not be used very long term.
Got it. Um, Moving on to now, what causes us to sometimes maybe abuse our mouths, and that is the food we eat. You know, there's I mean, sugar is become a bigger and bigger part of almost all our diets. Um, but then there's also stuff that we do for good health, like fermented foods. So, what is your view of do for our fermented foods while they're good for overall health? Are they good for the oral health or not? And similarly, sugars, ultra processed foods, they are known to be bad for overall health, and I assume they're also bad for oral health.
Well, it is like this. There is no direct correlation between a balanced diet or a particular kind of a diet and oral health. There's no direct correlation in terms of health. But there is a direct correlation between eating coarse food with roughage, like raw fruits, vegetables, apple, etc. They're definitely very useful in reducing or eliminating plaque that collects on teeth. So yes, quality of and roughage in food is important, useful to be consumed on a regular basis. Carbohydrates that are consumed from highly processed food are bad. I mean, that they stick around, would have potentially karyogenic implications, especially they are when they are then they are snacked, because when you snack, those things linger around and they are potentially dangerous because food staying in contact with teeth would reduce the pH in the mouth, would start uh, uh, by degradation of carbohydrates into acids, and that does mean that you are kind of initiating caries formation. Sodas, those those drinks that contain citric acid, uh, fruit juices, and sodas uh, are not very good either because they are highly acidic. One tends to have a soda over a period of time, so that means you're keeping that pH of the mouth low for that long a period of time, and that has detrimental effects because that can cause increased wear of teeth, and so that's not a good thing to do. Say when you consume something, the pH of the mouth suddenly dips within minutes, and for it to come back to normal, the existing, shall we say, buffers of the mouth from saliva take a few hours for it to restore it back to normal.
Wow.
So if you continue to consume acidic food for a long time or acid producing food for a long time, your mouth is going to stay acidic for extended periods of time. Coming on to fermented food, which are rich in probiotic, they have bugs which can help maintain, restore balance of microbiome of the mouth. Things like yogurt, kimchi, but they're not indispensable. I mean, one can have healthy oral physiology even without consumption of those. They are more useful for your gut and otherwise. So they are not a treatment or a relief or physiology maintainer for the mouth per se.
Yeah. But my one big takeaway from what you just said, Paresh, is that snacking, especially unhealthy snacking, while it's bad in general, it also has a pretty big impact on the mouth because, like you said, it just keeps the mouth in an acidic state for longer and longer periods of time.
Absolutely. See, we consider cavities and gum disease as the only two oral diseases, but there's a big endemic which we face all the times as we are able to have teeth stay longer, as in extend their lives by preventing cavities and preventing gum disease. What we are seeing is that wear is becoming a very important, shall we say, condition that we need to treat. In aging population, wear becomes extremely, shall we say, relevant. And these acids producing substances or elements or diet really make that wear element progress much faster. And
And Paresh, just to
that's
clarify, when you say wear, it's
yeah.
sort of the enamel is beginning to
Yes.
break away, right?
Yeah. So the tooth consists of enamel on the top and dentine inside. The enamel is hard, dense. It has mostly 98% plus is calcium, hydroxyapatite. Uh, and it's quite glassy in structure. When that wears, and that's highly resistant to wear, by the way. But when that wears because of eating food which is very coarse, or acids in the mouth, or wrong brushing, etc., the dentine inside gets exposed, and the dentine is much softer. It has a structure like it is porous. It has tubules. Call it like a coral, and that being much lower in calcium content wears much faster. So you have an accelerated wear once the enamel has worn out, which causes sensitivity and etc etc. So the accelerated wear occurs when that top layer of enamel is gone, and that's not a typical for a middle-aged person to happen because of food, grinding of teeth, etc. Wear is a multifactorial disease condition, and acids make that more complicated.
Yeah, that's very, very insightful, Paresh. There is a general fear, I think, that dental work can be both expensive and painful. And there are two different fears, but for someone who wants to avoid going, they are the two most commonly used excuses. What do you think about these two issues?
Yes, I'll address the pain part first. Well, one hasn't gone to a dentist and has pain now. Uh, I'm sure the dentist is not responsible for that initiation of pain. So, if you could prevent, you will avoid pain. Yes, dental procedures have had this flack about being painful, but in today's time, they need not be known as painful procedures. It's very funny, but the procedures of which are very shall we say complicated, which are very aggressive or morbid in terms of the procedure or the trauma that they cause, don't necessarily cause so much pain as some stupid things like an after ulcer in the mouth or
Hmm.
a cheek bite can cause. So pain does not necessarily relate to the procedure. Having infection of teeth can be extremely painful, and that's where most of the bad experience of dental pain begins. And sometimes the some of the initial part of the treatment may have some element of pain, but today's local anesthesia, the way we use our drills, etc., uh, we diagnose more accurately, can reduce that pain to a very very large extent. So I think an empathetic approach, use the right tools, the right anesthesia, can make one, I won't say pain free, but be very acceptable in terms of experience. That one need not be worried about the pain as a feature of dental treatment. An injection needle is going to hurt, but after the injection needle, one can have a completely pain free experience. Is what I'm trying to say.
Yeah. Paresh, I just want to
As
add to what you said, and this is from a
yes,
personal experience which I have shared with you, but just for the
yes,
audience. When I first, about, I've always been a big supporter of the dental community by going to the dentist very often.
thank you
And
so much.
in the early years, I remember every trip to the dentist, I would, sort of just be scared of that experience because it was very painful. But in the last, I would say 20 years, uh, that's not been the case. And I think it's been a combination of dental technology also advancing to the point that you made, Paresh, and also what you said other outside, which is there is an empathetic approach. And there was one time I remember sitting in a dentist chair and my hand flinched a bit because there was a little bit of pain. And immediately the dentist said, "Oh, did it hurt? Then we need to take care of that." I'm like, really? So far, I've lived my life being feeling like going to the dentist meant pain. And so
Yeah.
this is just a message for everyone else that uh, that has changed dramatically. So if you ever are avoiding going to the dentist because of pain, to what I think Paresh said and my own experience, that's no longer a reason to not go.
It need not be. I mean, I'm not trying to say it will never be, but it need not be when taken care. There
Yeah,
can be dental experiences which are, I often get patients who say, "Oh, this was nothing compared to what I'd imagined." What you imagine is not necessarily true. What you
yeah,
imagine is completely out of proportion at times.
yeah, yeah. And then you were going to address the expense part of it.
Yes. Now, try and understand, dental clinics are not low tech like they were 30, 40, 50 years ago. They're pretty high tech. They involve significant amount of equipment, and most of the time, dentists are stand alone or in a small group where everything is essential. You can't do without an X-ray or the right kind of equipment. So the infrastructure in a dental clinic, as simple as it may be, is not cheap. That's number one. Number two, please appreciate that when a dentist works on you for an hour, it's an hour surgery. It is not a 15-minute chat followed by an examination followed by another 10 minutes chat and some discussion about health. It is 50. It is that period of time's surgery. Now that means time is spent doing intense action. So it's not necessarily time alone. Thirdly, I spoke about the infrastructure, equipment, the time spent by dentists, and the dental materials and gadgets and and instruments, and what goes in the mouth is not pretty cheap as well. Often we need lab support, which can significantly add to the treatment cost. So there's a multi, shall we say, factor economics involved in dental treatment. Sometimes some procedures are very, very simple, though may they take time. They don't really cost much, but sometimes some procedures which require all these things going together could be, pricey. I wouldn't call them expensive, but they would be pricey for some, for somebody who's not aware of dentistry of today.
Yeah. And I also want to add, experience has been that if things are handled preventatively versus after there's an issue, it's always better. Number one.
Absolutely.
Number two is a good, a trustworthy dentist. And I've had the good fortune, especially in the last 20 years, of having that. They are not going to recommend things that you don't need. Half the times I found earlier that I was told to do stuff which a second dentist would say, "Hold on, why were you told to do that?" I said, "I don't know. You tell me." Right. So I think taking care of things preventively and going to a dentist you trust addresses the expense thing very, very comfortably.
I would like to add one thing here. Often you will hear that a dentist recommends doing something when you don't have trouble, right? And that is because you need to understand that the trouble may come when it is too late. It is like making a patch in time or making a patch well. I like to call this a life cycle of teeth. You start with a healthy tooth, you get a small cavity. If that cavity filling that was done in that is not going right, the decay may go underneath the cavity, the filling, and may head into a root canal. That becomes the next phase of a tooth. If that bad filling was found in time and if it was redone, you could prevent a root canal from happening
Yeah.
and thereon and thereforth. So if a crown was made and it has poor fitting margins, those poor fitting margins are going to undermine the decay, undermine the crown, make the decay so bad that the tooth may not be salvageable anymore. So you're going to lose that tooth. So attending things in time is going to save a bigger procedure going forward. So a conscientious right dentist would ask you to do the right things at the right time, and would make you, have lesser procedures required as you go forward.
Yeah, absolutely. And I think it goes back to once you trust your dentist, then if they tell you something, you'll do it. Versus, I don't know why am I being told to do this. Um, uh, what are general guidelines, Paresh? If for the audience, if you had to tell them, here are a few things, do them on a regular basis. I'm sure we've all heard of the usual things, but from your perspective, what would you tell us all to do?
Well, I would begin with saying, you know, uh, make sure you know the brushing technique right. In today's time with YouTube, you will find ample right ways of doing using the right brush with the right technique. It's not just about how many times I brush, but it's brushing it correctly. The brush needs to be right. It needs to be soft, not the hard. Use the right kind of toothpaste. Toothpaste that promise so much don't necessarily perform that. Typically, the white toothpaste that contain fluoride are recommended. Uh, uh, the right kind of brushing is going to prevent cavities as well as gum disease. Make sure that you see a dentist regularly. Depending on the patient's age, the dentist may recommend certain preventive interceptive treatments, like for young kids where teeth are just about erupting, one may recommend application of fluoride or sealants, which prevent new cavity formations on newly erupted teeth where there are some, pits and fissures, etc., etc. So see a dentist. 3 months for people with lots of issues, especially immediately after treatment. 6 monthly for those who don't get too many issues often. Sometimes I tell some patients not to come back even for a year or even longer because they just don't have any trouble at all. So your dentist should be able to take a call on how frequently one needs to see and come back to the clinic. The right habits, like the right food at the right time, not eating in between meals, rinsing your mouth at least after food. Maybe if you're not going to be able to rinse, save the coarsest part of the meal for the last. Say, for example, a carrot or a cucumber for as the last in the meal is something that is highly advisable for maintenance of elimination of all the carbohydrates, sugars from the mouth, and maintenance of mouth, which is more physiologic in general. And observe something that is not. Be watchful, be mindful about something that doesn't feel right. Uh, you get pain in the joint, some clicks, pain in some muscle. Be mindful about these experiences. If you look in the mouth frequently, look for changes in color, changes in texture, etc., etc. Don't diagnose yourself, but if you find something that's out of the way, please see a dentist, and he should be able to decipher, diagnose that for you.
Yeah, no, that's pretty clear and good takeaways for all of us. Um, I know there are a number of questions coming up, so let me ask the last one from my side, and then we'll go to the questions, Paresh. What's the future? I mean, I know you're such a technophile, and you're always keeping up with all the latest and greatest. Uh, I know, for example, people need or should try their best to keep their own teeth for as long as possible. But are we getting to the point where you can actually grow new teeth in a petri dish and it works as well?
Well, growing teeth in a petri dish as an experiment is has happened. We have been able to grow tissues in a petri dish from from different sources, and some of that has been applied as well. But as a tooth by itself, grown and put back into the mouth, is, I think, a long time away. It's almost as good as us talking about uh, making a community on Mars. Though theoretically and technically it may be possible, it's still a long way away. There's lots of advancement that has to happen, and there's a reason for that. Growing tissue is possible, but making a tooth of the same size, shape, and dimensions that fit that place in the jaw is not an easy task. The teeth form the way they are because of, what we know as a magic of embryology. Embryology is such a fascinating science where why does one tissue become that and why does the cell next to that become something else is a very complex thing. And teeth, for their formation, imagine you have 32 teeth and no one tooth is like the other one. So, uh, for us to be able to make such teeth designed to go in that place is not such an easy task. So, yes, there is potential. There are experiments which are heading in that direction, but it's not. We are not there yet, and we're not going to be there probably in our lifetimes.
Yeah. That just, I can't stop myself from asking this other question, though I said that was
Sure.
my last one, which is, you mentioned there were patients who you say don't come back for a year or more. And then there are
Yeah.
some who have a lot of issues. Does genetics play a role in why different people have different issues?
Absolutely, without a doubt. There are people who have, the right, shall we say, kind of teeth, which are with the right kind of saliva, and they don't have karyogenic potential that makes teeth be prone for cavities or prone for gum disease. And there are people who have either karyogenic potential or gum disease potential. So yes, you are predisposed. It's not a cause for having dental disease, but yes, you could be more susceptible to having. It's like saying having high BP. Is genetics a cause? Uh, Potentially yes, but your lifestyle is going to have more effect on having BP than having high BP than the genetics. So it's pretty similar to that. So there is predisposition, and your actions or lack of actions would make you, shall we say, have issues than the genetics by itself.
Yeah, there is a saying, genetics loads the gun and lifestyle pulls the trigger. I
Oh
think
yeah,
there's one more
that's
example
nice.
of that. Right?
Yeah, absolutely, that's nice.
So let's get to the questions. I mean, there's a comment from Gitanjali, did not realize those pearly whites have a lot more to do than just a pretty smile. I think great takeaway. Um Ajay's question is a receding gum line a problem? How does one protect against it?
Well, you start having gums that recede, one because of gum disease if it is not treated in time. The gum apparatus, which consists of gums, then there are fibers that attach below gums, and then there is bone that would start getting damaged if gum disease sets in. When gum disease sets in, uh, that has got damaged to some extent. You have teeth cleaned and gum treatment done. You're not going to grow that gum apparatus back. So that's when you start getting gum disease. Uh, Excessive brushing, the wrong tools used in the mouth can cause recession of the gums as well. But that's not something that means you're doomed. I mean, it is something that is still maintainable. It is preventable going forward. So uh, it's not uh, it's not the end of the world. It's not beginning of the downfall. Uh, it's not aging as well. I mean, aging does not necessarily cause all of these. So there has to be a certain reason why you start having recession of the gums and roots getting exposed. So you should be able to prevent that by doing the right things at the right time.
Perfect. There's a question, I think there are a couple of questions you've already answered, but there's a question about a startup, and we won't talk about a specific startup, but it's really a question about AI based scanners and information. Is that world there yet?
Yes. Uh, uh, those who've been to a dentist are aware of making impressions, right? We make impressions to be able to make models or do several other things with them. So this impression making process eventually was made into a model, a physical model. Now with technology, most of our labs are doing a lot of, shall we say, processing of these models, say making crowns or making dentures digitally, because that can be designed digitally, manufactured digitally by printing or by milling. So, dentists were the laggers in the whole chain. Labs were far ahead of us because they adopted digital almost 10 years ago or more. But now, in the recent past, scanners have become more affordable, and more clinics have these scanners, which allow us to record the anatomy of the mouth, the contours, very accurately. with digital scanners. So we get a DCM file, which is a 3D image of the mouth, and that is where things can begin. And there's a lot of AI used in that, so that these scans are effective, they are quick, they have lesser errors, and they're more efficient to make. Yes, so AI is used there significantly.
Got it. Dental care for aging parents. What are the must do's and the must avoids?
Well, having a dentist that has taken care of your teeth for long enough, and seeing the dentist regularly. I mean, it's so unfortunate that dentistry becomes the last in the priority or hierarchy of health maintenance. Prevention. So it's only when somebody is aging or ailing and has had some conditions or disease, only when teeth start hurting is when you want to see a dentist or want to call upon a dentist. Whereas you would want to check the D3s and sugars and all kinds of parameters on a regular basis and consult five other specialists for prevention of other things. I think dentists should be included in that.
Yeah, that's a very, very clear takeaway from today, for sure. Um, Swati's question: finding tea or coffee settling on my tongue and forming an obstinate layer. This is too difficult to remove even after scraping. What's the best way to clean the tongue in this case? And does this indicate any underlying condition?
Well, it definitely does not indicate any underlying condition. Well, my observation is that the black ones do not cause a coat. The ones which are not black would cause a coat, is my experience. I mean, it's personal. I can
Black tea,
validate
black
and
coffee.
trust. Yeah. Uh, yeah. I mean, I also the sugar in them is a big reason for a problem. So, uh, for me personally, it is black coffee and preferably no tea at all is what I do personally. But I can't really say everybody would have a coat on tongue after consumption. But I think something with milk and sugar would have more chances of coat
Got it.
than otherwise.
Paresh, one thing I've noticed, a sort of continuation of this question. I started about a few years back having a protein supplement. It was a
Mhm.
chocolate supplement, a
Mhm.
chocolate-based protein drink. And from the time I started having it, I started seeing this discoloration of my teeth. And every time I went for my teeth cleaning, that went away. And is that something that happens to everybody? Is it a case-by-case basis?
Well, stains that come on teeth are very funny. I mean, some people do have a lot of stains without doing anything. And some people, in spite of doing all kinds of wrong things, don't get stains. So there's no formula for having stains or not having stains. There are some bacteria in the mouth as well, chromogenic bacteria, which deposit colors on teeth. Black stains on teeth. Sometimes even the tongue gets black color, and these come from bacteria in the mouth. So we can't really do much about changing that. But yes, coffee, teas, tobacco, uh, supari, pan, all these things could cause stains on teeth, and I think some of diets, like you mentioned, can do as well. Yeah.
Got it. Swapna's question: what are the commonly used medications that impact oral health, and what
Oh,
precautions should people take with these medications?
uh, come on, Swapna, you should be talking about that because there is a whole list of things that can cause changes. But the ones that strike me the most are the ones that alter salivary secretion. And there are lots of classes of medicine that do that as well. Antidepressants, things used for glaucoma, chemotherapeutic agents, etc. The other thing which are noteworthy are ones that are used for epilepsy. They cause enlargement of gums. Some antihypertensives do that too. So these are, the typical ones that cause common issues. I'm sure there's a long list of so many other drugs which can potentially cause, but these three classes of issues can be drug induced for sure, and that's observed pretty commonly. Yes.
Right. I know we're running short on time, so I'll just quickly do a couple more. I think Swapna has quite a few others, but I think we covered most of them. Uh, Shashi had a question: is it recommended to see a gum specialist, specifically a gum specialist, once a year after the age of 50? And if there are gaps, is it recommended to go for aligners?
Well, you need a gum specialist only if you have gum issues. I mean, you go to a cardiologist only if you have high BP, some ischemic conditions or whatever. So, I mean, it is kind of need based. If you've had history of gum disease, yes, definitely by all means. But a general dentist or a hygienist in America can take care of the preventive aspects of that. And the gum specialist is typically, shall we say, specialized to address problems that you have, not maintain hygiene. So your general dentist or hygienist should be the one that you should be seeing more regularly, and they would be in a position to recommend you to see a gum specialist if required. Well, and aligners are to change, to make teeth move. So spaces are not necessarily the treatment. Not necessarily is aligners. It depends on where these spaces are and what is the cost for that, and etc. So it's not a call that one can take just because.
Yeah, all spaces are not equal.
No, all spaces are not equal. Yes.
Yeah. Um, Sonali, you have a question, but Paresh has answered that question on the community on oil pulling for oral hygiene, and I do want to say that Paresh himself is on the community, and some of the questions that were brought up even 3-4 days in advance of today's meeting, Paresh already answered them. So that I think should address a lot of the questions that were brought up. But I think that's the list of questions we have, and so. Paresh, thank you so much. I mean, this was absolutely an amazing session. I thought I was an expert in teeth as a consumer, but I learned a lot. And I hope everybody else on the call appreciated all the stuff you shared as much as I did, and I'm sure they did. So I hope if everything works and people benefit, please give us the feedback. And Paresh, I'm sure there are 20 other topics I know we had wanted to talk about, which we didn't get a chance today, but if you're up to it, we'll do one more session in the future. Or just one session.
Absolutely, it was wonderful. I'm so glad that I could share whatever experience or little things that I know. If it could be helpful to many of us in the community, I would be very happy to have contributed to their health. Thank you so much for putting this up together. And things in dentistry are exciting. New things that we do can be a game changer in many ways. They change people's lives literally. So talking about them can be exciting. Yes,
Yeah.
sure, we would look forward to that.
Perfect. Thanks a lot, Paresh, and thank you, everybody else. Bye.
Bye bye.